Well, tell me more about what people can do if they have the core machine and they're monitoring their inflammation. They want to know that they can manage it, that they can reduce their or improve their ESR measure, reduce their inflammation. You mentioned keto, and this makes sense to me. Have you looked at grounding?
We have. We have, and this was one that was very surprising to me, because I
Oh,
didn't understand any sort of mechanism for why grounding should work. But in our patient population, grounding works. Um, and that's at a population level. So is it going to work for you? I don't know, but
it
try
will.
it. Yeah. Okay.
Unless you're already grounded, that is, unless you're regularly grounding your body,
Right.
uh,
Yeah.
the human body will be subject to the accumulation of static charge without electrical connection to the earth. And this is physics. This has got nothing to do with enzymes or your microbiome or anything like that. Without that electrical connection, the zeta potential of your blood changes in a way that encourages the agglomeration of the red blood cells and increases its viscosity, which is exactly the measure that you are taking when you're assessing ESR. And so I think you could run this experiment for yourself. You could do the ESR test with the core machine. You could then hop in your swimming pool, which is wonderful for grounding because, water is a good electrical
For
conductor and
sure.
it's in the ground. You could measure it again. And although you likely don't suffer from chronic inflammation, given your area of scientific and inventive interest, you will likely notice some difference between your pre and your post. And I'm
I do.
saying this because there we go. It sounds like you've run the experiment. I've got good imaging data. So this is putting a blood sample in a microscope and seeing the disaggregation of the red blood cells that result from grounding. I think
Exactly.
this is another physiological measure of how beneficial grounding is. The difficult thing is when people don't really know the difference. They feel it, but they don't attribute it to grounding.
Yeah. Yeah. Yeah, you're right. It's all about giving you a signal that is something that you can track. And, so you could say is how do I feel? Is that a signal? Yes, it is. But it's very blunt, right? So, this gives you, the tools from the blood are things to hopefully give you better, sharper feedback about what's going on. You're absolutely right. And I did this almost exactly the experiment that you described on myself and did lower my inflammation level. I didn't hop in a pool, but I went barefoot and I walked around in the dirt for a while and did a before after that way. And yeah, it
Eh,
did not take long to show up.
That's neat. You know that every Morozko ice bath is grounded, and the electrical connection is so strong that it's 30 times faster than walking barefoot in the grass. It's instantaneous. Some of the people who compare Morozko to acrylic tubs or fiberglass tubs or inflatables tell me there's something that they can't put their finger on and it feels
Very
different.
nice.
I know what
That
it
must be
is.
it. Yeah, yeah,
Yep.
yeah. Sure, because the fiberglass tub would not be grounded, not as well anyway. Um, the
What else
and you
could you
mentioned
measure?
ice baths. Ice
Yep.
baths are another thing that are evidentiary in our data. So cold
Tell me about it.
plunges, yeah, cold plunges will also, in our data set, they also are associated with lower inflammation levels. So,
Okay, there's a chain of logical inference that I'm going to make. And maybe we'll clip this and put this on Instagram or something. But here's the chain of logical inference. You have shown that cold plunging will improve, by that I mean reduce, generalized markers of inflammation, in particular ESR. We also know that chronic inflammation is associated with increased mortality or shorter lifetime. The chain of logical inference is now that an ice bath practice will extend your life by reducing your chronic inflammation, in this case, improving blood flow. This is something that I've suspected for a long time.
Yeah.
And there's multiple mechanisms. The grounding in the Morozko is terrific for blood flow, but there's also the vasoconstriction of the cold plunge is one of the few ways to sort of exercise your smooth muscle tissue. And it makes sense, especially when it's paired with sauna in thermal contrast therapy, that you can bring your blood pressure down, improve perfusion, that is, improve the circulation throughout your body, reduce inflammation, and that would help you live a longer life. Bob, do I sound like I'm full of crap?
No, that's a totally solid, in my view, a totally solid chain of logic. And it is only so if you are sure that the thing that you're using for feedback, has a good, in very rigorous study, has really good hazard ratio, to use the nerdy statistical term. So, is your signal uh, highly correlated with the outcome that you're seeking? And here again, ESR is. And so it's something that you can measure.